Hello and welcome in everybody. My name is Ryan and today we're going to be recording part 3 of my brain tumor journey. Now this is here in my apartment. I know traditionally I go to a park, find a park to do this at, but 10:05 p.m. and I figured I'd just record it here in my apartment. So here we are. So part 3 is going to be talking about all the symptoms that I have from my vestibular schwannoma, commonly referred to as acoustic neuroma brain surgery. Now, I talked about my diagnosis and why I chose surgery over radiation versus watch and wait. Those videos will be down in the description, so go ahead and check them out if you're interested. So symptoms that I deal with since my surgery: headaches, migraines, tinnitus or tinnitus, however you would like to pronounce it. I did confirm that with my audiologist that tinnitus and tinnitus are both the correct way to say that, so either way you want to say it is correct. Hearing loss, neuropathy, which is nerve pain, and then I deal with wonky feelings of like dizziness and unsteadiness. I have a vestibular ocular reflex disease as well as a vestibular disorder. And then what else? There is it goes with my neuropathy. I'm trying to think what it's called. Trigeminal neuralgia. So I also have trigeminal neuralgia, which that's a whole beast in itself. But we're going to go over all these symptoms and kind of, dissect each symptom and then let you know how that affects me. Oh, I also have severe dry eye in this eye. This is on my acoustic neuroma side where I have the hearing loss and the tinnitus. So we're going to dive into that as well. So let's start off with headaches and migraines. So traditionally, I feel like everyone experiences headaches. I don't think anyone in this world has not experienced a headache. Migraines, however, are very, very intense forms of headaches. So migraines are like headaches that are so extreme that you have to go lay down and go to sleep. At least that's how it is for me. When I have my migraines, I cannot deal with any sound, any light, anything to that extent. Like it could be the littlest sound, it could be the littlest amount of light, and it'll put me out. Like I cannot. It feels like a overwhelming pressure that's building up inside your head, and it's just like ready to explode, and it feels like your brain is, kind of expanding within the constraints of your skull. It hurts really bad. Migraines are no fun. They are they're very debilitating, and to have them every day like I do, it's a struggle. It's a struggle to say the least. Because when you think about migraines for what they are, traditionally when you have a migraine, it's not like a headache to where you take ibuprofen or Advil or Tylenol, whatever you want to take, and then that migraine is gone within, 30 minutes to an hour, maybe a couple hours if it's a really bad headache. Migraines, on the other hand, they last almost all day. At least for me, they do. I'll get a migraine and they last hours upon hours, and some days even all day. So when this happens, as you can imagine, it just puts me out. I can't do anything. I need to go lay down, go to sleep. And typically, that's the only thing that helps me when I get migraines. I've tried all kinds of migraine medications, but I did not tolerate them very well at all. So I don't take any migraine medication because of that. So I always have to just go lay down and go to sleep and then hope that when I wake up, my migraine will be gone. So that's how I deal with my migraines. Again, they're very hard to deal with. I wish I had a better way to explain it. I feel like me explaining the whole brain expanding within the constraints of your skull is kind of like a good way to put it. And again, like the noise and light, it just sets me off so much more. Like it's like you cannot be around anything, you cannot hear anything, you can't see no lights. You have to be in a completely blacked out room like you're in the Batcave. Like that's it. Like seriously, you do. So I deal with those every day, and again, they're pretty debilitating to where I have to go lay down and go to sleep. I can't play on my computer. I can't do work on my computer. I can't sit, on my couch and watch a TV show, cook food, anything like that. Like everything is off. It's off the table. I have to go to bed. That's how it is when I deal with my migraines. So, Now, the neuropathy that I deal with, so I deal with neuropathy and trigeminal neuralgia. If you're not familiar with that, trigeminal neuralgia is considered one of the most painful forms of pain that you can experience. It is a very sudden, intense pain like no other that you can even imagine. And it just comes on again like very suddenly, and it's super, super intense. And it usually affects either one side or both sides of the face, but it usually only affects the one side of your face. So my side is on my acoustic neuroma side where I had my surgery. So basically, with trigeminal neuralgia, it is the nerve that runs to your face, like throughout your face. That's the trigeminal nerve, and it controls all kinds of things like facial expression, speaking, swallowing, and it runs down, I believe, down into your neck as well. Don't quote me on that. I could be wrong on the neck thing, but trigeminal neuralgia, when it happens to me, it puts me out just like the migraines. It is a very, very, very intense pain like no other. I have a pretty high pain tolerance, I like to think. I have a lot of tattoos. I went through brain surgery. I think my pain tolerance is pretty high, but trigeminal neuralgia, I am a complete baby about. It is awful. It's actually referred to as the suicide disease because of how painful it is and how unbearable it is to live with. There are medications that you can take for it to hopefully help. A lot of those medications are anti-epileptic drugs, such as gabapentin, Lyrica, carbamazepine. I actually just got prescribed carbamazepine, and I need to try it out. I haven't tried it out yet, so hopefully that's going to help me. But really, when I have these episodes of trigeminal neuralgia, basically what happens is it's a super, super sudden, intense pain that feels like a stabbing, shocking, and burning pain all in one. And where I have it is in my incision. So I have my incision here. You might not be able to see it as well because my hair is starting to grow over it. But from here, and it runs all the way here to the side of my forehead here. That's where my incision is, right? Well, when I have these episodes of my trigeminal neuralgia, I feel it all shooting up through here, and then it gets behind my eye here, and then it shoots all the way down this side of my face, and it hurts so, so bad. I actually had an episode of it yesterday, and I had an intense episode hit me, and it was really, really painful, very, very hard to get through. Again, it is just like a shocking, stabbing, burning sensation all in one. If you can think of the worst pain that you've had in your life, and then maybe times it by like 1,000. I say that, and I mean that in such a positive way. Like, I'm not downplaying your pain in any way, so please don't take it that way. I'm really just trying to shed light on trigeminal neuralgia. It's awful. It is so, so awful. And it's something that I deal with from my surgery. And again, it just happens. It just flares up. Like, I could go a couple days and not have it, and then boom, all of a sudden it's hitting me out of nowhere. I'm feeling like I can't do anything. Like, it really, really puts me down. Like, I cannot do anything. Like, it actually makes me cry out of my one good eye. We'll get to that. We'll get to that here in a bit, but I can only cry out of this eye since surgery. But again, we'll get to that later in the video. But that's how bad trigeminal neuralgia is. It really, really hurts, really puts me down. Thankfully, I have a wonderful support system, for those that might be experiencing that. Reach out to others, reach out to your friends, your family, support groups. There's a whole bunch of support groups you can join, not only for trigeminal neuralgia, but, acoustic neuromas, vestibular schwannomas. There's a whole bunch of groups on Facebook that are very beneficial in my opinion. And then also the Acoustic Neuroma Association website. That's a very beneficial website to go to if you are diagnosed with an acoustic neuroma, or if you know someone that is going through this. That is going to be a very, very good resource to go to. They have all kinds of FAQs and resources for doctors, research, all that stuff. Like, it's a super, super good website. Go check it out. I promise you, it'll be very helpful. So back to trigeminal neuralgia. Sorry, I got a little off on a tangent there. Again, it's something that is just super, super painful. I would not wish it on my worst enemy. Like, it is such a inhumane amount of pain to experience, if I can put it that way. Like, that's how painful it is. It's awful. So I deal with that. Thankfully, it's not every single day, but it's most days throughout the week. I'll just have episodes where it flares up. Oh, and I almost forgot. So when it flares up, it's, for me, pretty short-lived. I know in other cases for people that have this, it can last for hours or sometimes days at a time. Now, I've had episodes where it has lasted for a couple days, and I have episodes where that are more frequent to me. It comes on, like I said, very suddenly, and then it's usually over within about an hour, a couple hours. If I'm lucky, it'll be over within like 5 minutes. But again, there's nothing that I can do to prevent it. It just happens. Now, I know the research behind it shows like talking, chewing, swallowing, things like that, touching of the face. Even if it's just like the wind on your face from your window rolled down, like that can trigger it. There's all kinds of trigger points that can just happen and trigger that pain for people that experience it, like myself. In my case, I can touch my face and I'll be fine. And then on another day, I can do the same thing and touch my face and it'll trigger it. Same with eating. I could eat certain foods and then I could not eat that same food. And one time I eat the food, it'll trigger it. The next time I eat that same food, it won't trigger it. So it's almost like a cat and mouse game in a sense, because it's like, it almost feels like, wow, like when I have it happen, for example, like I'm eating steak. The steak triggers it. My mind then recreates that and reinforces the behavior of don't eat steak because it's going to trigger your pain, right? And that's an awful way to live your life, to have to constantly be thinking about, am I going to be able to eat this food because it flared me up last time? It's hard. It's really hard to deal with. And if any of you guys out there are dealing with it, I know what you're going through. I know what you're going through. You are not alone. Okay, I want you to know that first and foremost, that you are not alone. And I'm here if you need to talk. You know, you can just shoot a comment on this video. I love communicating with everybody here on my videos. You guys have been so awesome and so nice to me regarding all my things with my brain tumor, just like talking to you guys. You've been so supportive, and I really appreciate that. Thank you so much. And, you know, I make these videos just so I can help others and hope that I can give others hope and to not give up on their lives and stuff. You know, this is a very hard thing to deal with. So really, you know, that's why I make these videos, is to really just help others and give them hope, because, you know, it can be hard. It is hard, but you got to find the good in the bad and find something worth fighting for every day and keep going. So I'm here, though, if you need to talk. Again, I'm going off on a tangent. I apologize. So anyways, that's trigeminal neuralgia in a show, pretty much. Really hard to deal with. And then my hearing loss. So I lost a lot of hearing in this right ear. Thankfully, though, I was able to preserve some hearing in this ear. Traditionally, with this surgery, it's a high-risk surgery in which you will lose all your hearing. Now, my team that I had, I'm very thankful for them and blessed that they were able to go in and do the surgery. They completely removed my tumor out, and they were able to preserve some of my hearing. So that was so wonderful. Now, as a result of my hearing loss, I lost over 85-90% of my hearing in this ear, and I cannot hear certain frequencies, such as low frequencies. So like low frequencies would be like bass heavy frequencies. So as you can imagine, listening to my favorite songs that have bass in them, or, watching movies or anything that has to do with bass, like even video games, like wearing my headset, right? I don't hear bass in this ear at all. And it kind of makes things black and white in a sense when it comes to just this ear. Hearing with this ear, it's kind of just like mundane, It's just so plain and static. Like it doesn't have that rich fulfillment of sound. I don't know if I'm sounding kind of dumb saying what I'm trying to express, but I'm just trying to say that in this ear, sound doesn't sound as alive and crisp and like colorful and just full anymore, It's more of like dead sound. So, I had to do a whole bunch of hearing therapy for a whole year though before I could get approved for my hearing aid here, which this is my hearing aid. I'll go ahead and take it out. Now, this is my hearing aid here. It's a Bluetooth Signia hearing aid. It's all black. Black's my favorite color, so I had to get the black. But we got that, and after a year of therapy, hearing therapy again, I was able to go ahead and get my hearing aid, which was wonderful. Now, my hearing aid has a built-in tinnitus feature, so that helps like an unbelievable amount. Okay, I have tinnitus, like I said. So from my surgery, I have tinnitus. Tinnitus, I'm gonna put a sound in the video, and what I want you guys to do is put a pair of headphones on. And what I'm gonna do is I'm gonna put a sound of tinnitus, and I'm gonna play it only from the right headphone, so I can kind of emulate to you guys how it is for me living with tinnitus. Okay. And so tinnitus is just a buzz that is being created with inside your brain. It's actually not a noise that is coming from the outside. Your brain is generating this noise, and it's very annoying to say the least. It's very annoying. It's just this constant. It's just like a constant buzzing, right? I hear it right now, even with my hearing aid in. But when I take my hearing aid out, like I just did to show you guys, it goes up a whole bunch. So like with my hearing aid, all right, this is where we're at. So this is my tinnitus level. All right, we'll do the left hand. Tinnitus level with my hearing aid in, okay. And then tinnitus level without my hearing aid in. It goes up about twice as much, honestly. It's a pretty big difference. Like I said, I still hear my tinnitus with my hearing aid in, but having it in, oh my God, it helps so much. I cannot stress how much having my hearing aid helps me, okay? Because tinnitus, if you guys haven't had it, which I'm sure a lot of you have, a lot of you probably have experienced tinnitus. A lot of the population does experience it a couple times throughout their life. But those that experience it, it's usually very short-lived. You'll just randomly be like, what the heck? Why am I hearing this buzzing? Like, where's that coming from? And then it just goes away. That's what the majority of the population experience with tinnitus, okay? Me, though, I have it 25/8. I say 25/8 because it's more than 24/7. Like it, every day, nonstop, never goes away. I never get a second away, not even a millisecond, half second, anything from the ringing in this ear. It has not gone away since surgery. And before I had surgery, it was pulsatile tinnitus. So, if you watched my other videos, you already know, but that was the heartbeat sensation. So I was having a heartbeat in this ear that was going with my heartbeat. So anytime my heart beat faster, the heartbeat in my ear was beating faster. So that was pulsatile tinnitus, but that went away in exchange for normal tinnitus, which is just a constant steady ringing or buzzing or like whooshing noise. There's a couple different sounds that you can hear with tinnitus. Mine is just this constant buzz, like I was saying. But to experience tinnitus 25/8 for someone like myself, it's a lot. It's a lot. So it's very distracting, for one thing. It's very distracting. Two, it's super annoying. Three, it causes me to have a hard time to focus. That kind of goes back to the distracting thing. But like when I'm trying to talk to somebody and all I hear is just buzzing in this ear, it can be very off-putting and very hard to really focus in on what the person in front of me is saying. So I have problems with my attention span because of that. Like, I guess attention span because I hear this all the time, but then also my concentration because I hear this all the time. Like, it's a lot. It's a lot to deal with. And now when I watch shows, I have to watch shows. I use subtitles. Oh my gosh, shout out to subtitles. I love subtitles. I always watch all my TV shows and movies with subtitles now. It really helps me be able to take in what is being said on the screen. Because even though I have a hearing aid, it didn't like restore the functionality of that lost hearing. It amplifies the hearing that I have left, but it doesn't restore the hearing that I've lost. So hopefully that makes sense. So basically, because I've lost all this hearing, my hearing is not going to be nowhere good as it was before I had to get this hearing aid, before I had surgery. Again, the hearing aid helps a lot, but it's never going to be to that level of not ever having to have a hearing aid, you know? But I'm not complaining. Again, I'm very, very grateful that I have some hearing left in this ear, that I do have a hearing aid that helps. So that's been a godsend for sure. And then moving on, what else were we talking about? So so my nerve pain, so that's neuropathy, so I deal with that. That's kind of similar to the trigeminal neuralgia, not to the extent of how intense that pain is, but it is very intense still. I'm not trying to brush that off as not being an intense pain, because it is. If you've ever dealt with nerve pain, you already know it's very, very intense pain. I would argue that it's more intense than breaking your bone or like getting a cut. Actually getting a cut is nerve pain. So like, yeah, it hurts a lot, you know? Like, I feel like if I had a deep cut, that's going to hurt a lot more than if I broke my finger, right? Nerve pain is a whole nother beast. And I have a lot of it on this side. Again, it's just on my incision side. That's the only place I deal with my nerve pain, is just in this whole area of my head. Now, I take gabapentin for that, and that helps a lot, so I'm very blessed that I do have that to take. But I have days where gabapentin's not even helping, and then I'll take ibuprofen or Tylenol to try to help also, and then that doesn't help. So then I'm sitting here in just this unbearable amount of pain. Like, it's awful, you know, it's super awful. And typically what I have to do is just go and try to lay down and sleep. Like, that's all I can do when it gets to that amount of pain. Like, if nothing's helping, I just have to sleep it off. And I pray that when I wake up, it's not going to be hurting like it was. Now, I'm a side sleeper, so sleeping on my side has been hard ever since surgery. I now really just sleep on my left side here, where before I had surgery, I was always a right side sleeper. But now, now I sleep mostly on my left side, because I notice if I wake up on my right side, that is a horrible start to my day, because I will be in so much pain from just laying on this side of my face. And again, I think that's part of the trigeminal neuralgia mixed with the neuropathy that I deal with. So, yeah, it's not a good start to the day at all. Okay, so nerve pain is a whole nother beast in itself too. But again, there's ways to get through it. There's medications you can take. There are some like therapies. I haven't tried them out personally myself yet, but like, what am I trying to say? Acupuncture. Now, I've heard about acupuncture being something that can help with nerve pain. I actually have not tried it out yet. I don't believe my insurance covers that. So I don't think I'll ever be able to try that. Maybe one day I will. I don't know. We'll have to see. But anyways, yeah, so nerve pain, that's nerve pain, right? And then moving on past the nerve pain, dizziness and unsteadiness. So, dizziness, you all know what dizziness is. It's awful. Think back to when you were a kid and you were on the playground and you had the little spin wheel and you were on there and someone came up, a bigger kid came up and started spinning it as fast as they could, right? And they won't stop and you're just like, oh my God, I'm going to throw up, I'm going to throw up. And you're like begging them to stop, but they won't. That is how it feels to have brain surgery, all right? Thankfully, it's gotten better than when I was, right out of surgery. When I was right out of surgery, I was having a lot of vertigo. Vertigo is a very intense form of dizziness. It's pretty much kind of what I just explained. It's a whole spinning, even though nothing is spinning, but you feel like you're spinning. So I was having that for a very long time after surgery. Now, I still do have it. It's not every day like it was, okay? Every day, it used to be an everyday thing for me. I've done a lot of therapy, I've done a lot of healing, and I'm thankfully no longer in the shoes that I was, where it was a non-stop spinning session every single day for me, every second of the day. Now, when I have it, it's mostly triggered when I get sick or get a cold. It usually flares up really bad. If I don't have enough sleep, it flares up. Or if I'm pushing myself or super stressed out. So like pushing myself would be going over my limits, right? Doing more than what I'm really able to. And the type of person that I am, so I was a very active person before my surgery, okay? I'm talking, I'd go running every day, I'd be at the gym every day, I didn't take no days off, I literally worked out, did something physical every single day. Had a very physical job. Played sports, all kinds of stuff like that. And then going from being very physical and having brain surgery and then coming out of that, there's a whole new baseline that you have to work with. Like, you're not able to do the things that you were able to do before. It sounds so simple. Trust me, I know it sounds so simple. But it's not. It's not that simple. When you go through something so traumatic as a brain surgery and you have to relearn to live in the ways that you used to live and compromise, and you have to compromise so much on what you're able to do and what energy that you do have to give. You have to really compromise with it. You have to decide, am I going to work out today? Am I going to go for this walk? Or am I going to do laundry? Am I going to go to the store? Am I going to be able to cook dinner? You have to make a lot of compromises, when you go through something like this. And even to this day, I still work in those confinements, those constraints. That's what I'm trying to say. Excuse me. I still have to work. I work in these constraints now where I have to decide, am I going to work on a YouTube video today? Am I going to go to the gym? Am I going to have energy after my doctor's appointments that I have? Am I going to have energy to go do this after my therapies I have to go to? There's a lot of give and take when it comes to having brain surgery and going through this initial recovery and even the long-term recovery. I'm in the long-term recovery now. I had surgery July 28th of 2021. My 3-year anniversary was just this past July 28th, and I'm still recovering. I want to stress that for those that are watching this and might be, so far out, or maybe you're just having surgery or whatever the case may be. It is okay to be this far out and still recovering, okay? Everybody has their own timeline. Everybody heals at different rates. That's not a race by any means. So don't go and compare yourself and say, well, it's not fair that this person had the same surgery that I did, but they're already doing all this and that, and I'm still over here and I'm not. Like, what's wrong with me? Did I do something wrong in my recovery? Am I not doing enough? Please don't think that, because I promise you, you're doing more than enough. Having to go through a brain surgery and then the recovery in itself, it's a very taxing thing on your body and your brain. The brain, I mean, it's so simple again, but the brain controls everything in our body, controls our thoughts, our actions, our muscles. Every little thing is controlled by this little organic matter inside our skull here, and you just had it operated on. Okay? Let that sink in for a second. It's a serious thing. So, anyways, it's just such a serious thing, and I just want to stress to you guys, if you're in a similar position, to not put so much pressure on yourself. Okay? I know this because I lived this. I put so much pressure on myself. I still do, and I hate that I do, but it's just the type of person that I am. I feel like I'm not doing enough, even though I know I'm doing enough. I have people telling me I'm doing enough, but I get stuck in this like grief phase of looking at the past Ryan and how much he was capable of doing and how much I was achieving, and then comparing it to the new Ryan that has to make compromises and has to live more in the constraints that have been kind of just placed on me because of the surgery, right? So, anyways, that's all I wanted to say for that is just, don't be so hard on yourself with it. Don't beat yourself up. Everybody has their own healing line and or timeline to heal, and you're gonna get there. It's just gonna take time. And if you're so many years out like I am, that's okay. You're healing. Again, this was your brain, the most important part of your body, arguably, besides your heart and lungs. Like, it's a big thing. So, but anyways, the dizziness is real. I deal with that every day. To the extent of the dizziness, like I said, it's aggravated more so depending on how much sleep I had, what activities I'm doing, how stressed I am. So that's that. Now, the vestibular ocular reflex disease that I have. So, if you don't know what vestibular ocular is, it is the balance system that is with your eyes. So, your vestibular system, a quick rundown, you have your feet, your ears, and your eyes. Those are the three systems that make up your vestibular system. Vestibular just means balance. So, you combine all three of these systems, right? The eyes, ears, and your feet. And that is why you feel steady throughout the whole day. That's why you're balanced. That's why you're not over here like falling or tripping or having to think twice about anything you're doing when it comes to just walking, right? Now, vestibular ocular reflex disorder, your eyes work together, and when they're working together, they're sending these images back to your brain to help stabilize. So if you think of OIS, like optical image stabilization in smartphones, quick rundown on that. OIS, take a phone, and you take a phone that has OIS, and then you take a phone that does not have OIS, and then you go and take a picture while doing this or just moving the camera. You'll notice on the one that has the OIS, the image that you took, clear as day, perfectly framed, no distortion whatsoever. The phone that does not have OIS, it's going to be a whole mess. It's going to be like that ghosting to where it's like part of my face is here, but then the other part of my face is kind of going across the image, almost like a smeared painting, if you would. So vestibular ocular reflex disorder is similar to that. So I have times where I get that ghosting effect like I'm talking about, like a smeared painting, where that happens because this eye, when I had surgery, part of that nerve got damaged. And so now when I have very fast moving objects, or if I have just objects and I'm really tired or more stressed out, or even when I'm sick, when that happens, I get these ghosting effects where, again, it's like a smeared painting where I'm looking at something and it's like, it's like a soul leaving its body. The best way to explain it again is like a smeared painting. You draw a portrait of somebody and then you kind of like smear it or whatever. Like that's kind of what that is. So I deal with that. And I did a lot of therapy for that. Now they mention prism glasses for people that have vestibular ocular reflex disorder. Unfortunately, the prism glasses are so expensive, and it's something my insurance is not going to cover. I think it's considered a cosmetic like contacts are. So it's something that I live with, and I have to deal with, and it can be hard and challenging, when that's happening, especially when I'm having like lower mental health days where I'm already feeling pretty depressed or anxious, and then I have to deal with like this smearing effect and thinking like, what, like what is, why, like why, But that's something I deal with as well, and therapy has helped a lot though. Again, I went through a lot of therapy. I used to experience it all the time after surgery, like every single day. But now it's more so like a lot of the symptoms in which it's just aggravated if I'm more tired, if I'm more stressed, if I'm sick, things like that, if I overexert myself. So that's the vestibular ocular reflex disorder. Now, the vestibular disorder that I have, that's a whole nother thing. The vestibular, again, is the balance system. And the vestibular ocular reflex disorder is technically a disorder of the vestibular system in itself. So that contributes to my overall vestibular disorder that I have. But also, when I went in and had surgery, they took out my vestibular nerve on this right side. And the left side was, what am I trying to say? On the left side, you have a vestibular nerve, and on the right side, you have a vestibular nerve, right? So you have both of these balance nerves on both sides. They work together to produce the equilibrium and make you feel, at balance at all times. That's what both of those nerves do. So, like, even though you turn your head this way, you turn your head this way, because you have both of those nerves, it's able to help you feel balanced, right? Now, they took mine completely out on this right side. So, doing this like I just did, I get super dizzy. Like, I'm getting so dizzy doing this right now. Like, just moving my head like this. Or, like, for example, when I'm driving and I have to turn over my shoulder, especially when I'm, like, on the highway, that's like where it's the most challenging, is when I have to get on the highway or I'm on the highway and you have to do like these quick motions. That really aggravates the vestibular system. And I couldn't drive for a while after surgery. When I got out of surgery, I didn't drive for, I think it was like 4 months, 4 or 5 months. I couldn't drive because of how intense my vestibular disorder was. It was super intense. But now where I'm at 3 years out, I'm able to drive. I'm a safe driver, no issue. I wouldn't be on the road if I didn't feel that I could drive or be safe. But, when I have days when I'm, again, really tired, super stressed, push myself too much, sick, I avoid driving because I'm not going to get behind the wheel and endanger myself and others because of my vestibular disorder. Okay, so that's what it is when it comes to driving, and then like turning my head, like I said. Now in therapy, they had me practice a lot with pinpointing on something, like fixating on something around the room, and then just moving my head while staring at that. Now we're going to go into that further. I'm going to go over therapy exercises that's going to help you or help others that are going through this. I'm going to have a whole video later in this series where I go over all these different therapies that I learned that are going to be very helpful. So stay tuned for that one. But going back to the vestibular disorder, I do have a walking cane I have to use from time to time when my balance is very hard to deal with, because I do have my days and my moments where my balance just feels like it gives out, and then I feel like I'm just like free falling through the floor. That's something that has not went away, is this free falling feeling. So I'll get this like sudden, like being thrown to the ground, and like I'm falling from the ceiling down into the ground beneath, and then up from the ceiling again and down, like this non-stop loop of falling from the ceiling down to the floor and then back up to the ceiling and then down to the floor. Now, I've been told by numerous doctors that that's just my vestibular system with that nerve messed up and me having a vestibular disorder. That's what's causing that. And that's very frustrating to deal with, So yeah, that's like the vestibular disorder. What else do we have? I think I'm trying to make sure I touch on everything. My dry eye, so I got diagnosed with dry eye syndrome on this right eye after surgery. So I have very severe dry eye. I'm going to throw pictures on the screen of the eye test where I had to do the eye test and everything. And so basically what this test does is it tests your quantity and quality of your tears. And so because I have this severe dry eye, it leads to my headaches and migraines. It leads me to be limited on my screen time. Like I have to be very aware of my screen time. Like I cannot be doing a lot of things on the computer for so many hours or on the phone or, watching TV for so long. Like I have to be very conscious of these activities because if I push myself and keep pushing myself, what happens is it turns into a migraine usually. And then that migraine usually lasts for a couple days. It's different than the other migraines I have. So, I have my migraines that I just get that usually lasts all day. And if not all day, lasts like 6 hours or so. And then I have these other migraines from when my vestibular system is so aggravated that it lasts for days on days. And it makes it very hard to get out of bed and do things and live a productive life because I push myself too hard on my vestibular system. Okay, so that's something to be mindful of if you have a vestibular disorder. For those that have a vestibular disorder, I'm sure you know exactly what I'm talking about and can relate to this. So that makes me feel a lot more comfortable to know that I'm not alone in this. So thank you. In the weirdest way, thank you. I hate that we're going through this, but, thanks for, being here for me as well and knowing what it feels like so I'm not completely alone in this journey of life living with a vestibular disorder. So there's that. I use eye drops every day. I have to use eye drops every day. I use a lot of eye drops. It costs a lot of money to have to use eye drops every day. I wear contacts also. I'm wearing my contacts right now. But since surgery, it's very hard to wear my contacts for more than a few hours at a time because of this eye being so dry. So I have to take my contacts out multiple times throughout the day to put eye drops in, clean my contacts, put them back in. It's gotten to the point where I really wear my glasses probably about 90% of the time. I just wear my glasses because it's a lot easier to deal with than dealing with having to take my contacts out, put eye drops in, put my contacts back in, take them out, put eye drops in, take my contacts out. Doing that all throughout the day, multiple times a day, becomes a lot. It just becomes very tedious and annoying. So I mostly wear my glasses, I'd say about 90% of the time. So I deal with all that. I deal with memory loss and trouble with recalling things with my memory. So like my short-term memory feels pretty fried, right? My short-term memory is awful. I have a very hard time remembering things that people just told me. I have a notepad that I write everything down on. I also use my phone app habitually. I do the note app on my phone habitually. I'm always writing notes on my phone. I have a calendar in my phone that I use. I have a calendar that I use here in my house. I have to have multiple calendars. I have to write everything down. When I go to doctor appointments, I write things down, or I ask them to give me a report to where it's very summarized and very detailed oriented so I know what was said, because again, I forget things a lot. Even like when I go to the doctors, sometimes I ask them if it's okay to just record this conversation so that way I can go back and listen to it. My memory is awful. It's awful. I don't know what else to say about it. It's just hard. A big part of that is the surgery itself, but then also all of the symptoms that I'm dealing with affect me in the memory department as well. Because if you imagine like dealing with pain all the time, dealing with tiredness, which I haven't even got to the tiredness, but the tiredness, the pain, the tinnitus with the ringing all the time, the hearing loss, it all adds up to be this whole like chaotic storm of like, I just have all these coexisting symptoms that, you know, affect me in a greater, bigger way, unfortunately. But it is what it is. You know, I hate when people say that too, because I say it all the time, and you know, it is what it is. But I feel like a lot of people say it in stride of like great disappointment and not really happy about it, like not being really happy with it, right? when I say it is what it is, I say it in more of a, like, this sucks, it does. I acknowledge that it sucks. But there's still hope, there's still good. I'm still here, I'm still living, I'm making this video for you guys. I still live my life every day like anybody else would, just a little bit differently because of my symptoms. But you know, I still do everything that I can. I'm a very productive person. I have goals and dreams and aspirations and all that just like anybody else. So when I say it is what it is, you know, I'm just blessed. I'm blessed to still be here and sharing this story with you guys. I know I go on a lot of tangents too. So as you can see, this video is already so long and I apologize. I like to just have these conversations with you guys and be as open and forthcoming as I can be as transparent as I can be. You know, I don't want you guys leaving this video and being like, oh my God, Ryan has just said so many negative things. He says he has tinnitus, he has balance issues, dizziness, hearing loss, pain. I don't want to do this. This is crazy. I can't live my life, you know, living with all these symptoms. Like, that's absurd. I'm so scared now. Like, and please, please, please do not leave this video feeling that way or thinking that way. I promise you, you're going to get through this. It's going to be okay. You're going to have an amazing story to share, and you're going to be able to inspire others and be hope for somebody else and be that light in someone's dark. You know, you're going to be that shining light that someone has been looking for. And you're going to be able to inspire somebody that needs that little bit of inspiration. You're going to change people's lives in ways that are unfathomable, okay? I promise you, you will. You will. You're not going through this for no reason. You know, there's a reason behind it, and you might question it and be angry and, you know, just, why me? Why? Like, and I get that. I was there. It's a part of the grief cycle. It's a part of grief. Everybody experiences grief pretty similar, but also, you know, differently. But, you know, the majority of grief is the same cycles that we go through with the bargaining and the depression and, you know, going through those types of things with grief. And it's very understandable. You know, it's very understandable. I went through it. I continue to go through it from time to time. I'm not going to lie, I do. I have my days where I'm just like, why me, God? Why did I have to go through this? You know, I'm not where I want to be in life because of this. I feel like this has been a big block in my road. It's been a huge roadblock that I've had to overcome and continue to overcome. And, you know, I found myself asking questions like this from time to time and doing the whole bargaining of, oh, like, well, I'd rather deal with this symptom or have had this happen or had this surgery instead of going through the brain surgery, right? And that's completely normal. It's normal. You know, that's just part of grief, and it's just part of the human nature, you know, to grieve on things that we once were able to do and we once had, and it's perfectly normal. It's perfectly okay. You're human. It's what humans do. So don't even stress about it. Try not to stress about it. You're going to stress about it, but, you know, don't put so much emphasis on all the things that you cannot do anymore or that you can't do, but rather put emphasis on the things that you can do and what you're able to do and what you're going to do and what mindset you're going to have and what you're going to do with that mindset, right? That's what's important. That's what matters. So, yeah, so please leave this video feeling better about the things. I'm not making this video to scare anybody or to upset anybody. That is the last thing and the least thing that I want to do. Again, I'm making these videos to hopefully help somebody and really just educate others on the things that people go through. You know, I feel like brain surgery in itself, I feel like it's one of those things where it's like you hear about it, but you don't know anybody personally, right? But it's all over the world. People are having brain surgeries right now while I'm making this video. Like, it's not a rare thing to have a brain surgery. You know, people have brain surgeries for all kinds of reasons, right? So, you know, it is one of those things. And again, I'm making this video, and I make these other videos to educate others on brain surgeries, on my brain tumor that I had, and just, hopefully inspire others, give others faith and hope, and then also, again, educate others and help others, treat others with more sympathy, and be more empathetic to those that are in this position, because it's hard. It's very hard. So, all right, guys. I know I have been blabbering for a long time on here, but those are the symptoms that I deal with, and that's, pretty much the gist of what I deal with and how I deal with things and the whole 9 yards on it. So I probably forgot to mention something somewhere, but, that's that. But yeah, I probably did forget to mention something, but this is going to wrap up the video. And my next video for part 4, we're going to be talking about surgery day, me prepping for surgery, and the whole surgery day and what that was all filled with and how that went. So I hope to see you guys for part 4. Again, thank you so much for tuning in and listening to me blabber for a long time. And I hope this has affected you in a very positive way. We will catch you on the next video. As always, peace and prosper. Much love. We'll be seeing you on the next one. Bye.